do that. So let me introduce you guys to Paul Long, and we're going to kind of learn about him. You got a microphone? Let's see. There you go. There you go.
Hey, everyone. It's a beautiful day out there, huh?
Yeah, this is like your first time at the Presidio, huh?
Yeah, we just walked down to the beach and it was nice. Although I learned that there's a nude beach not too far from here. So
Yeah, that's okay. That's your second visit.
Yeah,
okay.
fair enough, fair enough.
Okay, the first one. So Paul, tell me a little bit about your organization. First of all, I kind of tipped my hand that you guys have relocated out here, but you've got a long family history in the healthcare space. Maybe you want to tell us about both sides of the family and then how you guys found your way out here to California.
Yeah, actually a connection to what you were just saying. So the brother-in-law, he's now a mentor for me. We talked with him. I asked him when he was leaving India, having this experience where Mother Teresa had sort of thrown the gauntlet, so to speak. Said he prayed for two things. One was that he would be able to do anything like that. And he also said, Lord, may you protect my family and the work. And I think many of us know, how much goes into doing services and work and how important family is. So I wanted to start by just telling you about my family. So that's my wife and three kids there. My youngest one that I'm holding held me hostage last night from 12 to 5, refused to sleep. So anyone who's sleep training or has been through that understands the challenges there. I have a degree in ponytails and pigtails, and I'm working on a degree in French braids right now. But going to the India part of my life, so I have two unique people in my life that really informed a lot of how I think and the work that I'm doing now. So one's my grandma, who her and her husband in 1953 decided to get on a boat and go to India. So this was a post-colonial India that was sort of figuring out a new identity, and through that process ended up building a hospital in the 1970s to serve people. And then the other is my dad. So actually Kirk Noonan, I think an individual shared not too long ago to talk about small world. The picture there's an article that he had written on my father before I ever knew Kirk. But my dad's a cardiothoracic surgeon who invents artificial hearts and started with a clay artificial heart in his oven and ended up developing a magnetically levitated device. And we don't need to go into all of that. But I think through that, I learned a unique characteristic about unoriginal individuals is, I think a common thread is the obsession around doing common things and normal things. And I think that some people aren't always willing to do. But so those two people really had an impact. And then, of course, my wife and three kids.
Nice. So your own journey started off in Boston. You went to what, Boston College? Right?
Yeah, so Boston University. So I basically... I knew I was a science nerd. I knew I had these exposures growing up in India, dealing with poverty. Sort of had a dad that was a doctor. I didn't mind sitting in a library for long hours while people were doing other things. So what better to do than become a doctor? So I did that. I did college in Spokane, Washington. Then my medical school was in University of Utah. And then my wife and I actually thought that we were going to be going to India. And so we wanted some global health experience. So we went to Boston, where there's just a lot of great academic hospitals doing a lot of great work. And I actually, so when you figure out residency, there's this thing called match, where it's kind of like speed dating, where you have a list of places you want to go and they list you. And then you find out through this letter you open up where you go. And I didn't get the number one place, which was the Harvard Hospital, but I got a place that ended up being even better, which was the Inner City Hospital, Boston University combined with Boston City Hospital. I think the closest thing here would be like the General here is what the place I worked and trained. And there I ended up becoming a director, went through training and stayed on staff and became a director of an observation unit, which was a really unique and interesting place because a third of our unit was homeless, a third of our unit used substances. And it was people who were admitted for these conditions that generally should be treatable in a 24 to 48 hour window. But it became this opportune time while you're treating this acute medical illness to also think about the other issues that are going on. And so worked really hard to do that and had a great team and was just really entrenched in that work and learned a lot about sort of the issues that are within, especially from the health perspective, that are within major cities.
And you had the opportunity to do all of that through the COVID opportunity, right?
Yeah, exactly. Oh yeah, I have the picture there. That's right. So I don't think any of us want to remember those days too much. So kind of had this board meeting and where we learned about how bad it was going to be. And I was like, I think this is going to be bad, wife. And I was like, you should go to California. And I was thinking she'd go for a week. And then she never came back. And that's how we ended up moving here. So one of the pictures there is my daughter, and that was in the Boston Globe, actually. She sent a poster that we all put our children's sort of posters on the wall to remind us of our family while we were trying to figure out how to manage many people with COVID.
Well, that sounds pretty challenging, but you did learn a lot of stuff out there while you're in that environment. And I think that kind of shaped the way that you see patients and patient care and healthcare systems. Maybe you can tell us a little bit about some of the stuff that you learned or some of the observations you made.
Yeah, I think there's a lot of people who are overall thinking about population health and caring for people and how to make sense of that. So in that angle, I was really in this sort of academic hospital, healthcare system, very complex, lots of resources, which was really great. And the framework by which we were often working was metrics. So, when you look at specifically homeless populations, there was a 10 times mortality rate, longer hospitalizations, high emergency room utilization. There's 4 times risk of 30-day readmissions. And that was sort of our framework, how we would understand this problem and go about it. There's nothing wrong with that. But the only problem is that you're dealing with people. So people are not metrics. People are people. There's relationships a part of that. So I put a picture of a leg up there, which is kind of an odd thing to have in there, but it's like a cellulitis infection, which is someone who injects drugs often ends up with a skin infection called cellulitis. We admit them, and oftentimes in this system, we come around this problem by thinking about, okay, well, what's their length of stay? All of these sort of metrics that we had decided to think about. But at the end of the day, for that patient, for that individual, it's my leg that gets me from point A to point B. I don't really care about that. I care about my leg, and I'm thinking about my leg. And oftentimes I found that we would sort of quagmire things because we'd be so lost in thinking about these, what we would perceive as higher level analysis or things. And we define our projects and our goals around that. And we might sometimes miss the humanity part of it. And the moment where this really came to me was the picture there, I think on your guys' left here. I just finished a long shift, and in our unit, we had brought in some harm reduction programs and different interventions where we were really trying to help people who were injecting drugs. And I'd come out on the street, for anyone who knows Boston, it's right on Mass Ave there. And I looked around, and there was an individual who had about 100 clean syringes that they were just going through and counting. Now, I have no problem with needle exchange programs, but it was a moment where I really felt like I had lost the plot. This is a person who had probably gotten these needles through here, but I had lost the plot because I didn't know the characters in the story. I knew the characters that were on my team, but I didn't actually know the other people. And that was very problematic. And I sat on the bus all the way back up to Cambridge, where we were living at the time, and just haven't been able to stop thinking about that since. It's, so we spend all this time defining what we're going to do, how we're going to do it based on our lens. And then I never had stepped back to really, I didn't know, know one of these individuals. And that was really deeply problematic. It caused me to sort of step back from the work I was doing and trying to think about sort of what's next.
So this is that challenge between having programs and people of focus and then trying to figure out, how do you personalize it for the person that's in the journey, their unique characters? How do you wrap that into assistance to get them to a better place, right? That's kind of what you were struggling with?
Yeah, I think so. It's the fact, and we'll speak to it in a slide that's coming up here, but it's the idea that I had been coming from this problem from a top-down approach, right? I had trained in this institution, and I had looked at it from a top-down, and yet I had never taken time to sort of come down to the ground level and back up. And I think sometimes people paint this picture where it's an either or scenario, but I would argue that it's both and. You've got people in one camp that will often disparage the other camp, and then, and we've all seen that and experienced that, where someone who's maybe in the higher system or the more complex system will struggle with the heterogeneity of more grassroots movements, or some of the inefficiencies that are there. And they'll lose in that the value that sometimes those inefficiencies aren't actually inefficiencies, but that's actually growing at the pace of relationship, which is so key when we're thinking about these populations. So that was the part for me that was really like that switch that was trying to figure that out and sort of deciding like, hey, what's next here?
Right. So you got all this experience, you have all this, these learnings and observations that you've made, and then you make the jump out to California and you kind of like redefine your career path, right? Because you kind of start blending your own personal faith journey with your practice. Tell us a little bit about that, because I do a little research on you. I can't figure out like which one defines Paul, right?
Yeah. Well, yeah, my colleagues in Boston are still trying to figure that out. My counselor was very worried about me for a little bit. It was hard to fully explain. But essentially, I stepped back from full-time medicine and became a pastor at a church here in California. And now I work part-time. Actually had a little bit of clinic this morning at a place called La Clinica. Some of you may know. It's a federally qualified health center. There's based in Oakland and then other centers. I work there 2 days a week. But I really ejected. I hit the eject button, and I don't say that in any, like, I wasn't in a bad place. It just, for me, I was so intrigued by this idea of, if I've trained here, I've worked here. If I leave here and I come back down to the more ground level and I work my way back up, what is this going to look like? And so that's kind of the journey that I've begun, is this idea of hopping off this place up here, coming back down and working my way towards it. And through that, I've been at I'm a pastor at the Bay Church, and we've started a 501c3 that works in parallel, called the Bay Compassion. And really, my long-term big goal would be to create these places called compassion health centers, which the best way to describe would be this mixture of a primary care clinic meets a community center, and meets a respite area for individuals. And there's definitely models for this out there, people doing great work. But I think a place where we can envision holistic care. And a part of that, we're not there yet. We don't have resources for the brick and mortar aspect of it, but we're in the journey of building sort of the program side of things. So we have a literacy program and food markets. And the thing that we're going to focus in for the remainder of the talk here is our homeless outreach. Our lane in the work of homeless care is really in street-based care. We operate a mobile shower unit and partner with others to create mobile resource centers on the street. Some of you guys may have seen these sort of mobile showers that go around. There's an organization that's no longer there called Lava May that was in San Francisco that we learned from. And then Dignity on Wheels down in the South Bay is doing really great work with it as well. I have a picture there, the Water for All. I don't know if you guys know this study, but this was a survey done amongst homeless individuals in San Francisco a few years ago now. And it's really jarring, but basically 2/3 of the respondents had reported access to clean water that was less than the UN standard for globally, including all countries. And that's right in our hometown. That's right in San Francisco. And those are the kind of things you hear, right? We all have those statistics or things that we hear that wake us up at night. How can that possibly be in my neighborhood or, in the neighborhood adjacent? But that's the reality we're in. So, so our shtick is really to make sure people have, access to water, and through that, comprehensive services as well.
So that's where we bumped into each other, because I went with my outreach coordinator. So Anne Marie was informed that there were going to be a collaboration out there, that we were going to have a medical, a dental, we were going to have some other things, and a shower was going to show up. So I'm like, cool, I'm going to go out and check this out.
Yeah.
Right. And I sat down and watched you guys set up, and I'm like, this is pretty cool, because it's not just a shower, but it's a restroom. And the way that you took the approach of really greeting people, walking them in, making sure afterwards that they were getting coordinated, and then walking them over to either get clothing, get food, get a chance to get a clinical help. That was amazing to see that collaboration going on. And everybody was bringing this resources to them, bringing it out to a place where I think in that region, 75% of the folks don't have access to medical care.
Yeah.
Right in the county. And that was right here in our backyard out in Bethel Island. And I was shocked to hear that we have a section in the Bay Area that has that level of just disconnectedness with the community resources.
Yeah. It's been a journey I've yet to prescribe a medication on the street. And part of that's because we're partnered with County Health. And I wrote an essay on this. We're finding healing in a shower trailer. This idea of sort of is just this period of time, 15 minutes, where someone can just stand in a room. It's just warm water falling over them with the notion of care. And I think have really tried, and I want to be very clear, there's nothing wrong with metrics and higher level thinking, or not higher level thinking, but sort of this larger systematic thinking. But we've set this standard that we grow at the pace of relationship. So we certainly, look at metrics, but we're not going to assess sort of our next move based on that. And I think as I looked at sort of the values of We Heart SF, one of them is collaboration, and it's really invited in more room for collaboration, because I don't feel like the Bay Compassion needs to own the space of this, and what's happened really, and it's a beautiful journey. So we're out in Contra Costa County where we're doing this. is, when we started, in Martinez, it was a new thing. It was beautiful because the city of Martinez had bought into this, but not all cities are bought into it. There's a game of hot potato a little bit where it's like, hey, if we bring it here, we're going to bring, more people here. And I said, well, what if we set our goal that there'd be a place like this mobile resource center in every city in Contra Costa County? That would mute the argument that we shouldn't do it. And then from there, we could grow together. So we went to Bay Point and then Pittsburgh. But we didn't need to go to all the places because other people caught on and created their own. And most recently, we were invited to come to Concord, but there's another church that created their own shower trailer through seeing our model. So why should we go there? Like, why should I go somewhere where there's already a group that's doing it? And now we're going to be starting quarterly meetings where we're going to talk about, what it looks like to have best practices for this.
Yeah, and I was really amazed to find out that you guys also have a warehouse of resources, obviously connected with Convoy of Hope, which was glad to hear that you guys are connected with them. But you guys created a warehouse, and what do you do with the stuff that comes in there, and what kinds of things do you collect and distribute?
Yeah, so Convoy of Hope, this organization's really allowed us to scale into new ways. So we get a whole bunch of shelf-stable food there on a monthly basis. And then we've also been collecting clothes. So as you can imagine, when you're providing showers, you need to provide a new set of clothes and other resources that come with it. So we've used that warehouse, so we're praying for a compassion center. So even though it's a warehouse, we call it a compassion center. So, but we've used it to scale and to be able to provide services out on the street. But I think the other cool journey for us has been the ability to use that place to connect with other people. So we've met a pantry that existed within half a mile of another that had been running for 20 years that didn't even know each other. And through this sort of center, we're able to connect and meet each other. I think you guys have all, experienced this where the power of triangulation and those sort of new relationships, opening up a service has so many intentional effects and then unintentional effects, both good and bad. But those, for me, that's been that unintentional sort of just amazing sort of experience of just seeing how stepping into something where a partnership with Convoy can sort of have this exponential growth in a whole new way in which you're seeing other people sort of step up in new pathways to see for service.
Well, this whole Wednesday gathering, We Heart SF, has been that journey for us. We had a good small community here, and all of a sudden we had some amazing things pop out of the community that we just did not expect or we did not know even existed. So it's been kind of an amazing journey for us as well. So that's cool, the whole thing. So tell us about the philosophy, because you told me you alluded to this earlier that you started off with top-down programming and realized it needs to also have that bottoms-up approach, right? And then folks that are, you got to be focused on what you do best, but you got to work in concert with other folks in a collaboration. So you've got to be able to do top down, left and right, and pull it together in such a way that when people come to you, you know what you can do, but you also know who can do something else for them. And then it needs to be able to personalize that. Talk a little bit about the philosophy that really drives you.
Yeah, I spoke to this a little bit already, but I really feel like we need to be more open to sort of these both and ideas. I think humans have a tendency to be tribalistic, and we have a very hard time holding two thoughts in our head at one time. And I think that there's a way in which we can find more commonalities and differences and partnering around common goods. We talk about it as the difference. There might, a handshake. So there might be an organization that we can partner with in an interlocking handshake, that more intimate type of handshake. And then there's an organization where we can partner with just sort of a normal handshake. You can still handshake, but it's maybe just a little different. So rather than sort of seeking this, the differences, finding commonality. And I think when we do that, we're going to see a lot more wins. And I think this is absolutely necessary within, homeless care and outreach. So an example of this is, we were 3 or 4 years ago, a week away from starting a new location in Concord. And someone behind the scenes somewhere, basically, we had been working with the city. It had all been set up. And all of a sudden, we just got an email that said, this isn't going to happen. And just they cut it out from under us. And I think obviously you're frustrated. You've built a team. You've put a whole bunch of energy into it. And you can go in there, you have options, right? You can go in there and flamethrow and just, but we took it as an opportunity. We said, you know what, one of our emphasis when we really talk about is bridge building, and really maybe it's just not the right timing for this. And so you circle around, and we waited, and 3 years later, there was a different, city council, team, and they just put forward a $5 million proposal and handed out $5 million to different agencies, and they're going to be starting a mobile resource center on their street. And I sort of bring that back to the point that we're talking about here is you need city engagement. We can't, grassroots or smaller 501c3s like us need to be thinking about partnering with cities. We can't do like this notion that we could just go, and we could have just gone and parked anywhere, and we don't have to have the city. But I think journeying with the city, journeying with the larger health systems, journeying with the larger nonprofits, is so key and essential. And then I think one of the challenges in medicine, oftentimes as a physician, and some of you may just be experiencing this as you engage with your own healthcare, is this idea of individual health and population health. And you'd like to think that they're always congruous, but there can be differences in time. Example of this is just yesterday, my grandma's in the hospital in Kaiser, and we were advocating for another day. That was the right thing for her. And the system's trying to manage a population, and they're overwhelmed. Their ER's full. They don't have enough beds. They're not necessarily doing the wrong thing, but they're trying to manage a different problem while they're also trying to manage the individual. And so this is one of those other moments where it's like, how do we hold these two thoughts in our head at the same time that oftentimes overlap, but sometimes don't overlap? And so this idea where we invite this client-centered, but also thinking about how we are in the community. And so you lead with the relationships with those individuals, but when you step back, you have your meetings, you have your collaboration, you also invite this idea of what are we doing broadly in the community. And it's a both and situation. It can't be either or. I think both of them inform what you're doing.
Very cool. So you also have this idea that with the individual, I think you're touching on this already, where the individual, you're focused on getting them, they have a problem, you want to get them better. But it isn't about just getting them back on their feet and pushing them out the door. It's really about embracing the bigger life challenges that are out there. You got to wrap around them and kind of journey with them for the longer journey to get them back to a healthy place. Maybe you can talk a little bit about that.
Yeah. So my focus in medicine is internal medicine, and you guys have all probably heard this term preventive medicine, and preventive care. And I now hate it. And I hate it not because I'm about it, but because I think it's oriented us in the wrong approach. I think we should be about human flourishing and well-being. I don't think we should be about the prevention of problems, and in medicine, one of the ways we often orient ourselves to a patient is, so-and-so is X years old and has, chronic kidney disease, congestive heart failure, atrial fibrillation. It's this. And that's how I get to know that person. And if that's how you get to know that person, that's going to be the first window into that person. And now you have to create, when you're moving quickly, you're managing, you have to create framework. So again, I'm not disparaging this idea that we would partition up things based on problem-based analysis. I'm not saying that. But we have to also invite the idea that that's not the only thing we're doing. We have to think about what constitutes whole person health. And people are much more than the diseases or problems or the substances they ingest. They're, whole health and flourishing constitutes virtues, constitutes, good character, constitutes belongingness in community. And I think when we start talking about health in the context of flourishing, I think that change and that framework orientation away from this idea that we're just preventing badness towards we're really pushing for goodness in a holistic way is so important. And I think one of those, we can talk about housing first, for example. So I'm a fan of housing first for the most part. But I also think this is an idea where maybe it's a little bit too small. I think the idea, and where I really got this the first time, I don't know if any of you guys have heard of Mobile Loaves and Fishes and Community First down in Austin, Texas. And if you haven't, and you're in a homeless care space, you really should look them up, because I went to do a site visit, and it's the most remarkable place. They have a bunch of, they're 3D printing tiny homes, but it's so much more than that. They've actually built a community where people are working, where there's healthcare, where there's actually a graveyard to honor people who have passed, and really thinking about like what constitutes just the general values for people's lives. And so I think we've embraced and embodied this idea of a community first. What does it mean to be a good neighbor with someone? And I think when you start, and it's a part of that is a housing initiatives, we should not move away from that. But I think when we start with the referent of what does it mean to be a good neighbor? What do I like in my life for people to be a good neighbor to me? And what does it mean for me to be a good neighbor to someone else? I think this again opens up that idea where we're moving away from just solving a focus problem towards really thinking about a holistic care model.
Yeah, and I love that community down in Austin. We took our whole city council, put them on planes, and they spent 2 days down there getting a tour, living down there, and they realized that when you start addressing your homeless issues, you can do it in a very dignified way. You can create this new environment, and they can be a value add to the community
Yeah.
rather than just this black hole where they're just putting money into it and it just disappears. And they kind of like changed the philosophy for the city that I live in um, to a more positive, open-ended strategy. And for me, it was funny because you could do an Airbnb in a micro home and live just with them. So the way they work in that little community is they've got this porch, and every house has no bathroom and no kitchen. It's a shared bathroom, shared kitchen out in a central area, but they have one person who works most of the time in the tech space, who's very well, and there's a great model for everybody in the community, but there's 5 other people that are part of that group, and they share a refrigerator, they share a kitchen out in an open area. And I loved the model because that one person would come home and everybody celebrated together. They got their campfire going. They were out there kind of working together. It was a really interesting community dynamic that was going on in that space. Anyways, that's a whole different story, but
Yeah.
I didn't know you had gone down there too. That's very cool. But I do love the idea for you. While we do fund people of focus, groups of people where there are systematic problems across large groups, that we got to dive into the individual's journey through that, right? And we're both trying to get them better, but not so we can get them out of the building or out of the program or off the hospital bed, but back to a community that loves them and wants the best for them and holds them accountable and kind of works with them along that journey.
Yeah.
It is getting those two thoughts into our strategy is super important.
Yeah.
So you have done a lot of work out there, and I know you're still in the early stages. You're doing some incredible work, but you're not doing it alone. Maybe you can kind of talk to the slide a little bit about like, how do you measure success? How do you help people on this journey buy into it? What are you measuring? Why do you measure those things? Would love to hear some of that.
Yeah. So that, one of the values for We Heart Us of collaboration, it's one of the values for us. So I love the picture in the top right. Sorry, as a doctor, I think about anatomical right or not. So but it's for me, it's really the image of what I would always dream for this program to be and what I think makes it special and work. So we had a site in Pittsburgh that's become just this phenomenal place. Started with, we're in this cul-de-sac, and when it first started, we had like 1 or 2 individuals. So homelessness in suburbia is a little different, where there's little less dense pockets than there might be in San Francisco. So you've got to be a little bit more intentional about thinking about how far people may journey to come to your location. But we had this cul-de-sac has turned into this vibrant place to be. And we went there, and rather than supplant ourselves in doing it, we basically, there was a church that was there, and they have run it. And because they've run it, they've stayed it so much better than we could have ever done. They had natural connections to the city on the order of just family members and friends that all of a sudden drew new attention to it. It's been a collaborative effort between that church, a food truck, an organization called Loaves and Fishes. St. Vincent de Paul has helped us with the clothing side of things. We've partnered with Contra Costa Health. They have a mobile medical van. And then, of course, the city of Pittsburgh. So in totality, at most of our sites, we've got our health part, we've got our showers, we've got food, clothing, and then we really prioritize the idea of relationship building. Our growth, so we've been able to provide more and more showers over the last few years. In fact, we just got our data back that we provided over 4,000 showers this past year, which was from a couple of years ago, a few thousand more. And growth has really come through that just sort of snowball effect of partnering with others. Had over 3,000 volunteer shifts doing this. And you can't just do that by just staying in your own community. You've got to, sort of find new, people that are drawing in and interested in being a part of it.
Well, I love the fact that, being in the medical industry, you wrote a paper on this.
Yeah.
Right. So that's
yeah, it's interesting. We wrote this paper, and then my wife's in public health and studies human flourishing. So there you go. But we submitted an abstract based on our work, and we said, should we put our academic affiliations, because I'm still technically affiliated with an institution, or should we just try to go on our own here? And we faced our first conference rejection because we didn't have that. We maybe have just been we just didn't have a good abstract, and that I'll certainly put that out there. But we kind of floated in this space, and that was a real eye opener for me. How many stories and people are we missing because we can't, unless they don't have that tag of Harvard University or Boston University? How many people are doing really influential work and missing it? And so I put out this essay called Finding Healing in a Shower Trailer. And the individual, Brendi's mad that you're going to meet Brendi in a sec, but she's mad that I put this photo there. But Ron was the story. And in brief, it was a beautiful man who spent a few decades in Folsom Prison as a result of addiction and subsequent crime. But he, and then while in prison, was stabbed. And I thought he had had a stroke, but really it was from this traumatic injury that he had. And I met him in a tent. I dropped off a bunch of Granny Smith apples, and he laughed because I guess in prison he had made wine out of apples, which I didn't even know you could do. But we would walk him down. And that was sort of my beginning journey of really discovering how approaching the problem this way could lead to real healing. So, yeah.
So I know that we have like a video here, so we're going to try this. It's always our technical challenge to get this up and running, but we're going to try and give you a connection to one of the people you guys are working with. Do you want to kind of set this up? What are we?
Yeah, so this is Bob, and he's going to tell you his story here. Me being a doctor, I got really intrigued with Bob because he had many illnesses, and I was curious about those and how I could help and how I could step in. But he's sort of the prime example of someone. It is much, much more than a constitution of just their diseases and illnesses.
Oops, hold on. Let me go back one.
The way I ended up homeless is I lived on boats for 15 years in the Delta. And the last marina I was at, I was on my boat at 1 o'clock in the morning. Somebody ran down the dock and went, "Get off your boat, it's sinking." I went, "Huh?" And I stood up and slid sideways across the floor. And I immediately grabbed my pants, my shoes, a shirt, my cell phone, and a cell phone cord, left my laptops and my iPad and everything I owned on the boat and got off just as it was going down. My name is Bob Burkett, and I have in the past been a jeweler and martial artist for almost 50 years. My jewelry work and artwork has been on the covers of magazines. I've been written up a fair amount. And in 2006, I had 2 heart attacks, 2 TIAs, a triple bypass. About a little over a year and a half ago, a boat I lived on sank at Big Break Marina. And right then was what changed my life. So I lost absolutely everything I own, which is all my jewelry molds, $20,000 worth of jewelry equipment, all my portfolios, hundreds of drawings, family pictures, everything. And I ended up living in my car for 16 months. I have a room that I rent, which is, reasonably priced, but all they have is a bathtub. And because of my health issues, it's really hard to use a bathtub, kneeling down, bending over, all that stuff. So I still rely on this place for a shower once a week. This has been my weekly perfect day because I come here and see people that treat people like human beings and understand that being homeless doesn't mean that you're a druggie or an alcoholic. This is like where I can come and connect to people that are kind and loving. And this program is invaluable to me. I know that everybody here is here for a reason. And it's because they want to help people. And they've helped me tremendously. But just talking to people and seeing that people are here just to help, no other reason, is pretty remarkable. And it's made my life easier. I feel a tear, but you know, there, without this program, I don't know what I would have done.
Well, amazing work.
I think it's very subtle, but at the very end, he says, just talking to people. And I think a lot of people in this room are engaged in homeless services or others, but I cannot we have new volunteers who come and I say, if you don't clean one shower today, but you talk to someone, and you get to know someone, there's enormous value in healing that takes place in that. You can talk about nothing, but, and Bob's a great example of that.
So you guys are just getting started, but you have some target metrics in the community that you work with. You kind of understand, beginning to understand them a little bit better. You kind of know where they are and kind of the conditions they're in. Maybe you can talk about the audience that you chase down or that you try to serve in the part of the Bay Area that you live in.
Yeah. So, this pit count data and we've put up the 2024 pit count data.
It's a point in time, right?
Yeah, exactly. So basically, for those who don't know, the way we capture sort of the number of homeless individuals in any given area, and it's important data because it's basically based on that data is funding for it. And so usually it's a whole bunch of volunteers who sign up to do this, and you get in your car. Has anyone done this or in the room or yeah? Okay. I've done it twice now, and you basically you start at like 8 in the morning, and for 4 hours. It's important to know this actually, because this is how like the data, like this is like the sort of gold standard data that's collected. So when you hear sort of a burden of homelessness in a certain area, this comes from this. But people get in a car, and you drive around, and you have an app, and you literally are just looking, and they give you, if someone's in a van or a tent or out on the street. And you tabulate it and you go around, and there's geo mapping, and then everyone comes back, and that single day in time is what is sort of understood as the burden of homelessness in that area. And it's from that data that we can understand the population that we're dealing with. And I think the things that are they should be jarring, when you look at it, is 59% of the people, report suffering from a substance use disorder. 61% suffer from mental health conditions. That one shakes you when you're a physician. How many times I've had to discharge someone who needs a mental health facility and there just isn't a bed. I think if there's one thing I could say with regards to, there needs to be more access. And I think that is just so obvious for anyone who's doing this work. There needs to be more access for mental health care and many different avenues for that. And I certainly think that ranges from inpatient beds all the way out to street-based care and access. And so that's something that we're trying to step into more. We've got a great street team that's come through the county called CORE that is able to get us to some of those access points and individuals. We work in conjunction with them. I think the other, jarring is the bottom one, 7% are under age 18. We partner with a nonprofit called Winter Nights that shelters families, and they have a safe parking zone, which is a place where they've created where people can stay there overnight without getting bothered. And I'll tell you, when you watch a high school girl, wake up in the back of their car to get a shower before going to school, and then you go home to your 3 kids in your home, you realize the unfortunate disparity that we live in, and that there's much work to be done. So yeah, that's how we've tried to sort of use this data and this information to guide some of the ways in which, the energy in which we're putting in a specific area.
And I think the number 7, the 7% for the emancipated youth, under 18 folks, and kids coming out of foster care, in that first year, if they go homeless, then we will see them as chronically homeless for the rest of their life, on again, off again. So catching them at the right times to make sure that we're not establishing patterns that they'll fall back to.
Yeah.
And setting them on the right feet, I think is super important early on, just if we're going to try and stem the tide a little bit. But some of the pictures you have here, I mean, you got folks grabbing clothes, and you got folks getting it looks like some care.
Yeah. Yeah. So gentleman on the left is getting wound care. That's my wife there with the hat over. But yeah, you don't have to be you don't have to go to medical school to do street-based care. And in fact, I love the big fancy medical vans, but all you need is a backpack, and you need some basic wound supplies, and you need a lot of love. And so a lot of really morbid conditions start really small. And if you can be that first point of contact that can do some of the basic things like wound care, you can prevent ICU admissions, down. And that's my big pitch to hospitals, which they already understand, but it's, if you can fund these street-based care. So healthcare systems, there's a large incentive because there's a lot of reimbursement around population health. How well are you keeping your population healthy? And so you target marginalized and vulnerable populations, and homelessness certainly falls into that. And so I've tried to sort of think about how we can tap into that and connect. So yeah. And then the clothing part is, man, I don't know if anyone manages clothing, but it's hard to do. You turn the spigot on, you get tons of clothes. But yes, we also bring out clothing.
That's cool. So you've learned a lot. Maybe you can share a little bit about some of the things that you've learned you want to share with the group. And we have action groups. We're always listening and trying to kind of adapt to lessons learned by other people.
Yeah. Let me ask you what time we're at, because I can go through these in very quickly, or I can take.
We've got time. Yeah, we got 15 more minutes.
So we have 15 more minutes. I just want to, okay, perfect. I just didn't want to blabber on and then miss out the most important part of the show. So, okay, some of these points I've already made, but I'll just go quickly through them. So I already mentioned the idea of community first, and I really can't emphasize that enough. And I think if you haven't, that organization in Austin, Texas, it's worth, there's videos and things you can find online about them, Mobile Loaves and Fishes. Their journey started actually as a mobile food truck that evolved into this whole community. And so I would love for us to start thinking about this sort of broader, and it's not antagonistic to housing first. Housing needs to be in there. Housing initiatives have to be in there. We must not undercut the support for that. But I think community first speaks to a broader thing. I think collaboration over domination. This is really hard for when you're a small 501c3, you're looking for funding. It's very hard not to sort of get cutthroat in different ways, but we must resist that urge as much as possible, because I think, and what we've seen is actually the county's been great here, because we've applied for funding with other organizations and they've brought us together so we can see each other. And it's been beautiful. I rather than me bringing people together, now county's bringing me together, and we can apply together collectively, working together, which is really the way it should be. And I mentioned bridge building is much better than burning it down. We must resist the urge to get overtly frustrated. We have to understand the challenges here. There was a rec center near one of our sites, and we needed to shut down the location for a bit, and I wanted to go do shower trailer there, and I got immediate resistance. I kind of went in and I was like, what is this going to be about? Are they just not about it? And she understood the homeless community better than anyone. It's that there had been some destruction of property and some other things that they were just trying to overcome. And if I went in there and just sort of lambasted and said, why can't you do this? I would have missed sort of all the work that she's already done in the community. I really think there's a role for local church communities. And even if you're, not a part of a faith community, other sort of roles, there's a concept of community schools within public schools right now. It's an interesting idea pushed down from Sacramento with a lot of funding. But I really think we need to identify these local community agencies that can do this. And if you think about the Bay Church, for example, where I'm a pastor, that's over 2,000 people with different vocational giftings, all willing to raise their hand and say, let me do something out there, whether it's one day a week or multiple times a year. We've got social workers, we've got other doctors, we've got educators. It's an army of people. And if we can mobilize them in the right way, the sky's the limit. Talked about growing at the pace of relationship. The other point's the cycle of compassion. I think this is important. Compassion should not be seen as linear. It cannot be seen as me to you only. There's a return with it, and that's not a made up thing. When you're serving someone, they are inherently served towards you. And I think the best imagery within the Christian tradition that I think Jesus teaches on this is the idea of washing, when he washes disciples' feet. He doesn't just finish there. He says, now you go and wash other people's feet. And I think that builds this beautiful understanding of how we ought to engage in the idea of compassion, that it's circuitous, that it boomerangs back, that I am being healed as you are being healed. And that is ultimately, I think, the most powerful way to think about caring for people. Avoid duplicity, aim to be additive. If someone's already, sure, I want to be a doctor. I like still being a doctor and prescribing medications. But if I was like, no, our shower trailer needs to be doing medical care. Well, we've already got a street-based fountain. We've already got a robust network there. So why should I go be duplicative there? Let me just put my medical toolkit and pull out some other tools that we can do and just do the work that needs to be done to provide the maximum amount of good. Showing up is key. So we show up on holidays, we show up on rain, and we show up in the heat. Because one of the greatest traumas is just people being abandoned, right? And they're in the initial periods, they're waiting for you to disappoint. And so some of the early healing and trust factor, it takes a lot for someone to get naked and get in a shower trailer, right? So you have to build that trust. So we had a Christmas Eve out there, and it was really meaningful and fun. Celebrate the small things because they're big deals. Sure, over 4,000 showers, that's great. But Bob's story trumps that all day. I'd rather journey with Bob's and, and just, I'd drink from the well of Bob's knowledge any day, just hanging out with people like Bob. Those are the small things, but they're big things in the end. And then playing the long game. Things get easier when you set your goals to 20, 30, 40 years. And you become less overwhelmed with like the month-to-month challenges. And I say that as I'm early on, we'll see as we go along. And then the last thing I'd like to say is we didn't invent homelessness, and we need to, the idea that people throughout history, all the way back to antiquity beyond, there's always been a fraction group that's sort of been separate or felt belonging. In the 1800s, it'd be train hoppers. A lot of people who ended up in San Francisco and West were people who maybe didn't feel like they belonged in a certain area. But this is a matter of deep issues that have tie us back to our history, and it's important to really think that way, because sometimes we can, especially in modern era, think that like there's something new, and there are some new aspects in the current age that we live in. But there's a lot that we can learn from looking back and reading about how people have thought about people ought to engage and belong from, historical literature and even just, early 20th century and 18th century, 19th century.
Very cool. And I really appreciate this. So now this is the best part of it. So we're going to introduce you to Brendi. Brendi, as part of your program, maybe you can tell us a little bit about Brendi.
Yeah. Brendi, come on up.
Hello.
Brendi, aka Brendizzle.
Faux shizzle.
I'm going to say it. Brendi taught me about the nervous burps today, but she doesn't have them right now. She said she gets nervous in these settings, but the thing is Brendi's a dear friend of mine and is just in a real way and a dear friend of my wife, Kate. Brendi, can you what are you doing? What's your life right now? Like, what are you doing? You're giving it away by wearing your hoodie, but tell us a little bit about it.
Go Bears. Well, I go to UC Berkeley. I live in University Village, which is family housing for students. I'm majoring in social welfare. And coming up, I don't know if I'm going to go for my master's in that or try to become a lawyer, which has always been the dream. We'll see where, the doors are open. I sit on the board of directors for Hope Solutions, which is one of the largest nonprofits in housing in Contra Costa. I am also the vice president of a nonprofit up in Lake County called Hope and Humanity, Inc. We're new. We just had a great thing back in December called Jackets for Juniors. Ended up being the biggest shindig Lake County has seen that was free for the children. We gave out 450 jackets to children in need, and we just had bounce houses and just all kinds of fun stuff for them. And I'm a volunteer with the Bay Compassion. Actually, Clean Start has transformed my life. This path that I'm on right now is because of my volunteer time there.
And let me ask, if we took a day, pick January 8th, 2016, 6 years ago, where were you at that time?
January 8th, 6 years ago, I was in a jail cell for the 62nd time of being arrested and serving time. It was actually my last time being in jail too. So, but shortly before being arrested for that last time, I was homeless. I was suicidal. I was on drugs. I was away from my family, my children, and everything I ever loved. And I just was miserable.
Can you tell us about how you got to know about Clean Start, how you found us, and sort of what Clean Start is sort of meant or been a part for you?
So after I got out of jail that last time, I got pregnant with my daughter, and I worked as an in-home care person, and I was invited to go to the church for an event that was going on for my niece that was going to the school there. And I saw a video of Clean Start program, and I was just flabbergasted, right? Like, that is the most amazing thing I've ever seen. I would have loved to have been able to go to a shower trailer when I was out there instead of the gas station bathrooms or the bed bug ridden houses, you know. And I was like, I need to be a part of that. So I kind of struck up a deal with God. You know, Lord, when I get my own car, because I still was unlicensed, and when I get my own car, I promise I'm going to be a part of that ministry. And fast forward, me and my daughter walked to work and school every day for 6 months to save up for a car. And within the first couple weeks of getting that car, I started volunteering at the shower trailer. And man, that was the best decision I've ever made.
So for the thing that has all there, it's actually quite funny because she has the insights that Brendi has. She's been like, I've learned more from Brendi than she's learned from me. And that's not just like simply say that's the truth. Like the way in which she's connected with people through her life stories and the journey that she's been on to leading her now being at UC Berkeley is quite phenomenal. Brendi, can you, I think sometimes for a lot of people who are maybe doing our best to understand how we serve this community, we're still a lot looking from out to in, right? Even as much as we try to get in there. Can you provide some insight or talk about when you're dealing with being out on the street or substances, how, like, what are you feeling inside, and what would you want people who are trying to help to know or understand about, like, how they might approach or even just begin sort of thinking about what you're dealing with and the pathway to recovery? And of course, there's a lot of people dealing with different things, but from your angle.
Well, you have to genuinely care about that person. Even if you don't know them, get to know them because they're worthy of love and they don't know it. They are miserable inside, and some of them try to hide it, and some of them fail miserably at trying to hide it. I was one of those ones. I was miserable, and the whole world knew it, and I wanted to burn the whole world down. Yeah, you know that saying where you have to meet people where they're at, and you do, because it's the only way to reach them, right? But then to love them is to pull them out, because they're never going to live a happy life unless they're out of that situation. Being on drugs and being homeless and being separated from everything you've ever loved in your life is miserable, and it's hell on earth, really.
Yeah. And I think for us, seeing you over these last 5 years as our relationship's grown, and honestly, how hilarious you are. Like she's not doing it now, but she's trying to figure out where to go. But just hilarious in demeanor. And there's ways in which, I remember once, I had this idea that we were going to clean up the trash in the encampment, and it was a bad idea. And but I'm there, Brendi's next to me, and she's just like, I guess we'll do this with this guy who's really just doing the wrong thing right now. So she was being kind. And but she was there having conversation with another person, and we were trying to love on and care for. And they were able to connect about jail experiences, even, singing like All by Myself and Solitary Confinement, just these kind of things. But there was, through that though, I realized there was a wavelength here of which I cannot traverse that, but Brendi can. And it makes her such a powerful agent. I think that's where it's not, and we can't sort of do this superficially. I mean, you have truly become such an integral part of the team and way in which we understand what we ought to be doing, not just because you were blessed, but because you have brought your insights and your knowledge and your experience to it. And you've sprinkled it with just a magical dust of like Brendiisms, that are just like hilarious. And so I think I really am thankful you came here with me. It was also an opportunity for us to get to hang out for a little bit extra time. But there's just no way to tell the story of Clean Starter Services without hearing the voices of like the Brendi, because I mean, you're going to do something. I mean, you're on a mission. And if there's anyone who's ever just been on a laser mission, it's you. You're in school, and I have to she was working in shower trailer. I had to tone it down because I want you to do so well in school, because I know what you're going to be able to accomplish with everything you're pushing and doing. So I don't know, Paul, if you wanted to open up to Q&A or.
Yeah, so we oftentimes allow for people to ask questions. We've got both Brendi and we've got Paul here. If you've got any questions about the program or about anybody's journey, feel free to just put your hand up and we'll get to you. We'll just take turns.
Yeah, thank you. And Brendi, congratulations. What a testimony that is. It's terrific and inspirational. Thank you for sharing about the work that you do. Your emphasis on not just triaging the situation, but thinking about the sacred dignity of the individual is something that we don't always hear a lot about, because we see a lot of buildings and infrastructure as being the top priority, but the reoccurring thought that's coming from the message that you bring is homelessness is not about buildings, it's not about four walls, it's about people and community. And it made me think this morning about the brokenness of American culture as an atomized, heavily hyper-individualistic, me first type of environment where people can't thrive, they don't know community, and there's a brokenness there. And people don't have a place to go. And so there's a lack of warmth in home, and there's something deeper at work in the brokenness that people are coming into this problem with. And so when you shared the video of the gentleman who lost his boat and his home, and then he's finding community and friendship and all of this, it's making me think homeless is not just about drug users and people who are down and out, but it could happen to the elderly, people who don't have family. It could happen to people in emergencies. But we as an atomized culture are not prepared to kind of embrace and have something ready for people like that. And that could be any one of us at some stage in our life where we don't have the preparation or the wherewithal to anticipate that emergency. And so it's a beautiful thing. So my question to you is, if money was not an object or a limitation, what is a dream setup to accommodate the kind of work that you would like to do ideally?
Yeah, that's a great question because I want it to be reality. So I think the Mobile Loaves and Fishes team provided a great imagery of it. I think that's part of it. I think I alluded to it earlier, that one of our larger goals is to create these centers called compassion health centers, and there be respite opportunities where respite is this idea that people, during this maybe acute illness or for whatever reason need a period off of the streets. And so we're going to provide a little more intensive care. So my goal, if money was not an issue, is to utilize our church land. So we have a church campus in Concord. We have a church campus in Brentwood, which is another just further east. We have a church camp in Pleasanton, and I would like to use the lands there to create these centers, to create this place where a family, and for homeless and low-income housed or for whoever, but someone could show up and receive, clinical care. They could, see a doctor. They could just hang out on the front lawn. They could garden. If they needed to, there'd be a place for respite where they could stay for a couple of days. And it'd be in the same place where a family of 6 would come, and maybe the kids doing after-school sports out on the lawn. We do literacy support right next to a clinical room. And we'd have a warehouse attached to it where we could have a whole bunch of resources that we could provide. And the whole idea would be a shared space where we'd have different organizations that could be able to be a part of that. I think that if we could scale into something like that, I think it would be, I think we'd be able to do a lot more in that place. And you mentioned, I don't want to.
Thank you. My question is about your comment that cleaning up the trash wasn't the right thing to do. Brendi, do you want to explain that to the rest of us?
Well, it's really pointless because the trash is just going to be right there again. Unless you're providing them with ways out, like maybe a giant trash bin or whatever, but Caltrans was already en route. There was no stopping Caltrans from doing what Caltrans came to do the next day.
Like there's just a knowledge base there that I might as well have just been like in another universe, but she can feel it. And Caltrans came and cleaned it, and they cleaned it the next day because I was like, let's get shovels and do it. So your insights were what?
my insights were Caltrans is coming and there's nothing that we're going to be able to do to stop that from happening, you know, and then Caltrans is going to come, they're going to sweep this encampment, and 2 weeks down the road, we're going to have another encampment sweep, you know, when they, I mean, it's just a repetitive thing. I mean, it's just the lifestyle of being out there on the street.
What would have been the better thing to do if you weren't going to spend your cycles and times cleaning up? What would have been the better thing to do?
Find him housing.
Thank you so much for your stories and sharing your work with our community. I was really struck by the story you told in Boston when you saw this person on the street with 100 syringes, and how that was like this eureka moment for you where, hey, you know, we're just kind of putting Band-Aids on this problem, but the problem really starts here on the street, and I'm just moved by your commitment to wanting to try to address those root causes and, you know, get behind the problem instead of just being, you know, always at the receiving end of it. I guess my question is that what was that dysfunction that you saw there? This person with 100 syringes, what breakdown in the system was happening there? You know, that really, I didn't quite get that. I didn't quite understand what that problem was. And I'm just curious how that moved you. So
needle exchange programs are part of this larger concept of harm reduction. And simply, I suspect a lot of us know what harm reduction is, but it's the idea that if we, there might be other interventions that are less harmful that would prevent more harmful behaviors. So something like methadone would be a form of harm reduction where it's better, you know, if someone's dealing with opiate dependency, I'd rather them take methadone through a controlled system than go inject heroin or fentanyl. Needle exchange programs really came around with this idea that in like 80s, 90s, especially during the AIDS epidemic, there was, you know, a concern about infectious disease being transmitted through dirty needles. So there's the idea that could we take that dirty needle and actually be providing clean needles for individuals to use? And there's evidence to support the prevention of things like HIV or hepatitis C. And then there's sort of studies that would suggest that that doesn't increase drug use, which would be the concern of it. Although there's other groups that suggest that there might be this offset indirect effect that would lead to increased usage. I think just one more thing to say about harm reduction. I'm just certainly a fan of harm reduction, but I think we need to be thinking about the indirect effects that come down when we have a specific intervention. So in this case, you know, I think there's a difference between providing one individual a clean needle and creating a system whereby there's just a stream of this idea that there's clean needles that we should just, you know, someone could just come and take 100 needles. So I'd been a part of creating this, you know, what I perceived as this sort of cutting edge way of thinking, let's get harm reduction in our hospital, let's do this. And it wasn't necessarily like a bad idea, because providing clean needles, you know, to prevent an infection, you know, in the right context can be a good thing, but in the wrong context could be a horrible thing. And what I saw, you know, because my center was a big, you know, Boston Medical Center, there's a lot of addiction-based care and training, a lot of funding for that care. You know, like things like methadone or Suboxone, these are great tools, but they're just tools in the tool chest. And we can't become beholden to those things. We have to think about those things as just something I'd pull out. I don't, you know, when you're trying to solve problems, we partition things, you know, we fractionate them into, you know, specific elements of them, and that's how we make sense of the problem. But the problem is humans don't necessarily exist in their life that way, right? Humans are a constitution of many things. And so while we break things down to make them simpler to be able to address them, we have to be able to also step back. And sometimes that requires collaborative effort to have someone who's in a different space thinking about it and working together. But the summary was, I had lost the plot of the story because I didn't know the characters in the story, because I never took time to know that person. And here I am, far removed from her life, and I'm directly responsible for the fact that there's just 100 needles that are counting here. And perhaps someone to them wouldn't think that's a problem, but I found that deeply problematic.
thank you.
So you said something I wanted to kind of bring up. The fact that the shower experience, I just been contemplating this in the last couple of weeks, is I'm where I'm at because I've had margin. There were times in my life where I was very busy surviving and bad behavior, and it was just crazy. And I never had a chance to really reflect what was going on. As I got more margin in my life and was able to take a pause and make choices to make decisions to go the next spot, I think it's huge. And I think giving people that space, that quiet time, that shower, that just as a pause, it's a reset, and it gives you that ability to take a next step. Brendi, maybe you can talk a little bit about having that moment where you can choose that next step. Where did you find the margin to say, I want to be different and I want to go down a different path? Where was that event for you?
That's a beautiful question. I was actually in jail. So I had that alone time, where I got to sit and think, is this the life I want to go back to? Do I want to go back to wanting to kill myself? So I spent a lot of time in the Bible, actually. And then I got to know, my higher power, and I got to know that I was loved, and that was a game changer. Somebody loved me that much, and I never knew that. So that kind of gave me the power to love myself, you know? So I was determined to change things when I got out. Now, I was also locked up with my friend from the street who I didn't even recognize in there, because when she's on the street, she's high, she's throwing bottles at cop cars, and she's just crazy, really. But in jail, she was completely normal. And she was afraid to go get an extra mattress because she'd get in trouble. And, she wanted to play cards with me on free time. And this was just a side to my friend I had never seen before. And I told her, man, it's night and day. You are night and day. And I never would have known that she was capable of that had I not seen her sober, had she not had the margin to show me that. And that's why I'm a big believer in people having that time to sit down, get some clarity, and to make that decision for themselves. I'm also, I'm a full-time student right now, but I was a drug and alcohol counselor. And, I wasn't able to keep in contact with my clients after they left until I left the company. And now I'm friends with them on Facebook, and I get to see them flourishing and knowing that I played the tiny little part that I played in that story is amazing, because they had the time to sit down and have people care about them and love them and want what's best for them inside that program. And I know a lot of people don't get to see the fruits of their labor, but it's there. I mean, I am a fruit of someone's labor. So, I mean, yeah.
This is very beautiful, very inspiring. And I've been, at this for a while, basically for 28 years, working with the faith community, trying to get them to get outside of the four walls, make a difference. And it's beautiful when you see examples like this. I mean, it's so powerful what can happen. It's also, you can get frustrated. It can be very frustrating. And I look over that period of time, and I mean, here you are inspiring all of us, and every Wednesday is like another group doing amazing work. And it's not hard to find groups doing amazing work. But you look back over the last 33 decades, and overall, if you zoom out, we have all these incredible players on a team. But if you're honest, as a society as a whole, we're getting our butts kicked. I mean, the problems we're addressing are getting worse. So my question is kind of open-ended to, I guess, to both of you. How hopeful are you for systemic change? And if so, either, one way or the other, why?
Yeah. Well, I mean, you always have to keep hope, right? You got to keep hope alive, or what we're doing is, for nothing, right? And we don't want to believe that. I believe one day the system will see where it's making its errors and change their ways. Now, I could go deeper into that, but I'm going to pass the mic to Paul.
I feel I resonate with what you're saying. I think because you can have good days and bad days, right? Where and I actually feel most hopeful about where we're going when I'm on the street, when I'm driving a 30-foot trailer now, showing up and engaging with the people that we're engaging with the Bobs or the other people. I think what we, yeah, I mean, because you look at substance use rates and you look at the opiate epidemic, and it's, we've maybe flattened things, but there's so much work to be done. I think this is a real time to sort of really try to get underneath what is the foundational problems here. We have beautiful society. We've caught beautiful people doing wonderful things. Yet we can still find so many ways where we're seeing divisiveness and struggle through that. And I think some of that comes to the ultimate question about, like, what does it mean for us to commune with one another? And this isn't just a homeless factor. We've got, think about elderly. If you look at food insecurity rates amongst elderly and sense of loneliness and despair in our senior citizens, those are the people that are the gatekeepers of our history, of our connection. In any other society, they're in the home with us. And yet we have, they're in other places. They don't come into our homes. That's not naturally what we do. So I think that a lot of this starts with us, taking a deep, like, introspective look within ourselves and identifying what are the things that are most meaningful here. Family, community. Brendi is like family. Our kids go to Jump House together, please do it another place next year. But I think that is living life with one another. And if we're so busy chasing some next aspiration, or if Brendi was just like another statistic or data point, like that is not ultimately like what this is about. Like, you're a real person with real things. And I think we have to take pause as we create new technologies and things speed up. We've really just got to take pause and have a moment about to what end are we doing it? It's so great that AI can now provide counseling because there's been counseling issues, but to what end? Should that erase the need for us to push for family engagement and involvement? No, it shouldn't. It should be both and. It should be additive, not erasive of things. And so I didn't answer your question in totality because I share some of your sentiment. I think there are moments where it's like, what else do we need to be doing? But I really think when I'm out there doing the work on the street, I feel so optimistic about the relationship. When we start with people, when we start with the person in front of us, I feel most comfortable with the idea of I have a sense of which direction to go.
Can I add one more thing?
Absolutely.
We live in a society where we just see people and we're like, okay, here's some services, but we're not empowering those people. Had I not gone to the shower trailer and had his wife not spoke life into me and telling me that I was able to chase my dreams, that they were not dead, that I could go to school, that I could get into Berkeley and reawaken these dreams that I've had since childhood, I wouldn't be here right now. I wouldn't be sitting here, and I wouldn't be at Berkeley living my lifelong dream. So these people that we're coming into contact with, we got to let them know, look, you are worthy. You are smart enough. You are great enough, and we need to speak life into them because we might be the only ones they come in contact with that will ever do that for them. And that could be the game changer in itself.
Amen. One of the things that's always inspired me and given me hope, I mean, in your example of it, I mean, you're inspiring me right now. But like, when I see people like you who, whatever you're learning from Berkeley, you probably learned far more through your dark season, from solitary confinement. And when I can keep myself in that mindset, and then I see the sea of, homeless encampments, and you're like, it hits you. But if I can shift my mind to say, no, this isn't the problem. These are Brendi's.
Exactly.
So then the magnitude of the problem becomes the magnitude of the resource that's available to solve it. And it's not about us solving it. It's about empowering them. And then from the inside out, people like you, I mean, you're this incredible, unstoppable, agent. And we have in our network all these other incredible, unstoppable advocates that nothing's going to do because hell's already been thrown at them and they overcame it all. What else can they do? That inspires me. So I want to encourage you with that.
Thank
too.
you.
Such an incredible story. Thank you so much to both of you for sharing with us. And we welcome you back to join us any Wednesday in the future. Wish you all the best. And I think the really great thing about this community is that it's about coordination. It's about bringing people together. This isn't a problem that's going to be solved through one person's efforts. We need to work on it together. We need to connect and join our efforts. So I hope that you can meet some incredible people in this room to join you on your mission. And if there's anything that you need from us, please let us know. Thank you for coming.
And Brendi.